Today we have a generously caffeinated video discussing dynamic neuromuscular stabilization, or DNS. As many of you know, DNS is a big part of what we do here at Gallagher Performance, and wanted to provide a little bit more insight into what DNS is and why it might be a great fit for you. So let's jump right in it. So what is DNS? DNS is all about understanding natural or normal human movement development after birth. So if you've ever found yourself wondering how a child is able to crawl, stand up, upright, walk, run, jump, and so on, yet no one's coaching them how to do this, and you see it just expressed over the first several months and years of life, what we begin to understand from this are the scientific principles of developmental kinesiology, essentially understanding that these movement development patterns in terms of achieving purposeful movement are ingrained within our brain, and they take time to express themselves as our central nervous system matures and begins to develop more coordinated efforts between our muscular and joint systems. So essentially, the heart of DNS is understanding ideal human movement and function, and in doing so, we can understand how, from a rehab or training standpoint, re-ingrain or essentially hit a reset on some of these things that once upon a time we went through from a developmental standpoint and played a critical role in our own movement development. So it does come back to movement, it comes back to exercise, and it comes back to how we maintain postural stability during those activities. So keep in mind, posture isn't a static consideration. Most of the times when people want to discuss posture, it's in a static sense, being standing or seated, but there is a posture that's associated with every movement that we perform, and it follows it like a shadow. So there are these reflexive postures that may be happening in inefficient or efficient means that can have a big part of why someone is A, either in pain, or B, from an athletic standpoint, suffering from poor performance, poor training, etc. So if we get back to this understanding of DNS and some of their principles, we can look at this diagram here and understand that some of the key components of DNS deal with respiration. Okay, respiration, breathing, done a lot of writing on this. You can see it on our blog. Won't go into a lot of detail here, but believe it or not, if breathing in the ideal breathing pattern is off, then no other human movement can be ideal either. This is one of the first things that develops during those critical stages a child is going through, is the proper function of the diaphragm and proper respiratory function. That will tie directly into core stabilization. So how well the trunk works from an oblique chain standpoint, and how that will feed our function of the shoulders, spine, hips, and our extremities becomes critically important. Again, that goes into quality of support. Talked about this earlier with postural stability. Our muscular system has a couple different functions. Of course, its role in movement generation, but part of that is understanding the quality of support or stabilization that our muscular and joint system is able to achieve will have direct relationship to the quality of movement that we express. The ability to control posture and maintain ideal movement stereotypes feeds into movement awareness. Okay, movement awareness is what basically makes great athletes great, when you see them moving with ease and very gracefully, but it's also why many chronic pain patients are chronic pain patients, because they have poor movement awareness. So DNS helps to address that and helps someone to understand better movement awareness through proper coaching, proper cueing on muscular and joint interplay. That feeds into this next concept of joint centration, or optimal joint alignment. Our joint surfaces should have an ideal congruency, and if it's off just a bit, that can change the orientation of the muscles around the joint, how those muscles feed into the brain, and the information that's sent back and forth in a feedback loop sense. So joint centration, or maintaining optimal joint alignment during movement, has direct connection to movement awareness, quality support, and then, as you can see, it's just going to kind of feed itself. So essentially, that's what DNS is all about. Now, the next thing is, people want to know, okay, well, if we develop ideal or perfect movement, is essentially, if you do look at children, they do things pretty well. Unless there is some sort of developmental delay or a lesion, such as cerebral palsy, within the central nervous system, they're doing things really well. So how are things lost? Well, like I said, there could be a developmental delay. That child could have been exposed to poor coaching or training techniques from an early age, and some of that's cueing and instruction. Likewise, another big reason why some of these movement patterns get disturbed can also be injury. So if, say, someone was casted and mobilized for a long period of time and maybe didn't have great rehab, or say if there was a surgery performed, those areas aren't going to function at 100% again. And there's going to be some sort of compensation or disturbance that is created within their system that will compromise how well they move. There can also be reasons such as poor anatomy. Some of us are just unfortunately born with anatomical structures, maybe more so from a joint surface or joint structure perspective, that will get in the way of ideal movement. And then there may just be some muscular insufficiencies, weakness, or even a ligamentous laxity that will create issues in terms of movement, and then where along the way things kind of go a little haywire and might throw off what's known or what we could consider normal movement. So a lot of this will then dovetail into our third point here, is finding the source of the pain. Finding the source of the pain and identifying the location of the pain, two different stories. So understanding that where someone feels pain doesn't always correlate with exactly what's generating it. So a lot of times, whether it's back pain or it could be a little bit more complicated in terms of, say someone comes with shoulder or an elbow issue, a lot of times rehab and treatment is directed towards those areas of pain. Someone may decide to rest, ice it, and then after a few weeks resume that activity that maybe was painful. A classic example of this, we're getting to that time of year, is golfing. We might have a golfer who has developed elbow pain, and maybe they're diagnosed with a golfer's elbow or a medial epicondylitis, and then they're instructed to rest, and they do all the good things that they're told to do, yet after resting and then resuming golfing, their elbow pain is back. Well, here's the reality. Your problem, or what's generating your pain, is not at your elbow. It's somewhere else. And if we think about the complexities of the golf swing, the rotation that's needed through the spine and the hips, the function that's needed in the foot and the ankle, as well as the shoulders, and then the tremendous amount of coordinated efforts through our muscular system, obliques, and so on, hips, glutes, we need to investigate all those areas, because chances are there may be something going on in one of those areas that I just mentioned that is playing into why that individual has pain in their elbow while they're golfing. A lot of times these golfers have been playing for a number of years, and then all of a sudden they develop pain. We can think about that in a number of other areas of the body, like I said, whether it's back, neck, hip, knee. Pain develops. A lot of times it can be associated with a given movement or activity, and even if they rest, we need to find the reason why that developed in the first place. And that's a huge thing that DNS is able to provide, is it answers the question, why? Why did my pain develop? Why am I dealing with these recurrences? And what can we do about it? So that gets into this last point here. How does this relate to pain and performance? Well, DNS becomes the means in which we can identify from an exercise standpoint, and a truly functional exercise standpoint, how can we improve muscular and joint function within the body to eliminate pain, minimize recurrences, and improve sport performance by essentially improving how our movement system functions. So that's the heart of it. We got to investigate everything in order to understand how movement may be relating to A, pain, or B, poor performance. And that's why DNS has become incredibly invaluable to not only our practice, but for those that we work with and who have seen the benefits, they've experienced the benefits. Hope you found that this video was informational. And if you find that you want to leave any questions, comments, please leave them below. We'd be happy to get to those. Thanks for listening.